Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Bayelsa State contingent for National Sports Festival in Edo State receives COVID-19 vaccination ahead of sports event. The Niger Delta Development Commission, NDDC, seeks Belgium's support in fighting coronavirus. And Germany extends lockdown by 3 weeks, imposes almost complete halt over the Easter holiday in response to a third wave of infections. Coronavirus daily deaths have declined in the past week, with no fatalities recorded in Nigeria in the past 48 hours. According to the Nigeria Center for Disease Control, NCDC, the death toll remains at 2,030. The country has, however, recorded 131 new cases in 14 states in the last 24 hours. The new cases are reported in Lagos, which had the highest figure, 64 new cases, followed by Rivers and Kaduna, with 12 and 11 infections, respectively. Other states include Plateau, Jigawa, Bayelsa, Ondo, Ebonyi, the FCT, Osun, Borno, Kano, Ogun, and Oyo states. According to the agency, 226 people have recovered and been discharged after testing negative to the virus. Today's report also includes 102 community recoveries in Lagos and 23 in the FCT managed in line with the guidelines. This puts the country's total number of persons discharged to 148,125. Currently, there are 11,713 active cases in the country, while over 1.7 million tests have been carried out. Globally, over 123 million cases and more than 2.7 million deaths have been reported, with the US, Brazil, Mexico, India and the UK, the top 5 countries, accounting for the highest number of deaths, above 120,000. As some countries in Europe experience a fresh wave of infections, the Minister of Health, Dr. Sage Hanire, is emphasizing the need for Nigeria to sustain its testing rate to identify, isolate and treat positive cases as government continues to work towards better outcomes of cases. In the meantime, 215,277 persons in Nigeria have received their first jabs of the Oxford AstraZeneca COVID-19 vaccine, following the delivery of nearly 4 million doses of the Oxford AstraZeneca vaccine through the WHO-led COVAX initiative earlier this month. According to Dr. Faisal Shuaib, Executive Director of the National Primary Healthcare Development Agency, who disclosed this at the weekly briefing of the Presidential Task Force on COVID-19. Vaccination has fully commenced, he said, in all states and the Federal Capital Territory except 4, and those states are Kebbi, Zamfara, Oyo and Kogi. He said only Kogi is yet to receive their own supply of the vaccines. But amid concerns over the efficacy of the vaccine, Mr. Shuaib says Nigeria has not recorded any serious adverse reaction following the administration of the Oxford AstraZeneca vaccines. Now, we look at the breakdown, and this is the latest breakdown of vaccination updates in the 36 states and the FCT and how the states are performing. Jigawa State has now reached 30.4% of its targets. This is followed by Bauchi State with 29.6%, while Kwara State has reached 21.5% based on their population. In the meantime, the epicenter of the pandemic, figures from the National Primary Healthcare Development Agency, puts Lagos vaccination figures as at today at 58,461. A recent tweet by the Commissioner for Health in Lagos says that according to Phase 1, those who are meant to be vaccinated in Lagos are health workers, COVID-19 response team, ports of entry staff, laboratory network, the judiciary, military, police, other security agencies, among others. The Bayelsa State delegation for the Edo 2020 National Sports Festival, expected to kick off from the 2nd to the 14th of April 2021, have started receiving their COVID-19 vaccination following the announcement of the guidelines by the Edo State Organizing Committee. According to the new rules, as a result of the pandemic, athletes and officials are to present certificates and documentation of COVID-19 tests and vaccination before admission into the Games Village in the state.
I feel okay. I was a little bit afraid if I will fall down after taking the vaccine, but I'm okay. And I really appreciate the president for making this possible for us to take the vaccine. And I know that it's very important for us. Without the vaccine, we cannot go to the qualifier.
We all know that there's been some misinformation on social media and even in public discussion circles. We hope every athlete will be vaccinated before then. I've had discussions with the commissioner, my colleague, the commissioner for health, and they've made their resources available to us to ensure that we vaccinate every athlete before the festival, and we're hopeful that we'll do that before we go.
The Niger Delta Development Commission, NDDC, is seeking partnership with foreign countries prepared to intervene in the Niger Delta region and the supply of non-pharmaceutical products for people of the region. The interim administrator of the commission, while receiving the Belgium ambassador to Nigeria, Daniel Bertrand, pointed out that COVID-19 can only be said to have been well managed globally when disadvantaged countries and regions get a helping hand from richer nations.
This is not the usual project inspection by the interim administrator of the NDDC, but a gathering to receive the Belgium ambassador.
Thank you very much, the interim administrator.
Belgium is said to be one of the European countries badly hit by the COVID-19 pandemic, but successfully contained the spread of the virus. And it's in this regard that the NDDC believes a lot could be gained from partnering with the country in areas of experience in managing the pandemic and exports of medical personnel to Nigeria to help contain the spread, particularly in the Niger Delta region.
We've seen the efforts of the country of Belgium in tackling the issues that relate with COVID-19. We know that as of 2019, Belgium as a country had a major challenge in the areas of COVID-19. Even the mutated form of COVID-19, they had major challenge, and they were able to come out of these challenges. We want to see a duplication. We want to see a collaboration in the areas of providing health facilities for the people of Niger Delta.
For the ambassador, working with the NDDC will not be a bad idea, because leaving out any country or region in the global fight against COVID-19 will be dangerous and will have a ripple effect in the long run, a view the NDDC boss clearly subscribes to.
I wanted to see you to better understand your institution, because it is a very important one. I would like to better know what you are doing, which are your priorities, which are your challenges as well, and to explore together what we can do together.
What we have seen in Belgium it gives us a lot of joy to see that we have a country, yes, being the headquarters of the European Union, they were in the forefront. They had issues, major challenges with the issues that relate with COVID-19, and they were able to, on their own, find solutions to these challenges.
Nigeria has received lots of support from the EU, the World Health Organization, and some wealthy nations in the fight against COVID-19. Since the virus is still a novel one, any support from more countries, in this case Belgium, will only contribute to lowering the curve in the battle against the global disease.
Let's go over to Anambra State and the efforts there at stemming the pandemic. Dr. Vincent Opala, the Commissioner for Health, Anambra State, joins me now from the capital. Welcome to the program.
Thank you.
First, tell us about the strategy for winning the COVID-19 war in the state. How has the state navigated its way in reducing community transmission?
Thank you very much. So what we have done as a state is actually to make a response very, very strategically, reduce the spread of disease in the state. Now, we adopted a COVID-19 chain of survival, which is a 6-linked chain that has helped us actually improve the chance of survival in the state while decreasing transmission. Now, looking at that those 6-link chain, the first link in the chain is compliance with the COVID-19 protocols and vaccination. So the number of people that comply with the protocol, the increase in chances of people surviving the pandemic. Now, the other one is early recognition of symptoms. We've tried to communicate that down to the grassroots. And then early identification with the system. There is early diagnosis and initiation of treatment. Then the fifth one is early initiation of contact tracing, and then early notification of results to the patients and initiation of treatment. So when you look at these 6 links, what it has done for us is that we've tried to decentralize surveillance, sample collection, and all those down to the 21 local government areas. So what all this does is actually to help us onboard people early to treatment, start early diagnosis, and all those. So when you do that, it helps bring down the disease burden in the state. And what we've noticed currently is a downward trend in disease in the state.
Tell us about the initiative, Igwe Buike. I mean, you talk about the principle of herd immunity, but with the vaccines you've received and based on the state's population, how far can you get?
Well, we got 78,810 doses of vaccine. We're about 5.5 million people in the state, so it barely scratches the surface. But the concept of Igwe Buike actually is the concept of herd immunity. If you vaccinate only one citizen, that's not going to be good enough. The more the number of people we vaccinate in the state, the greater the chances of stamping out the virus. So we've tried to preach this concept. When you look at some other vaccine-preventable diseases like polio or measles, with measles, you want to hit 95% coverage in the community for it to achieve herd immunity. With COVID-19, we don't know yet what that means in the scientific world, but we know that the more the number of people that you vaccinate, the greater the chances of keeping the virus away from the system. So that's why we encourage our citizens to come out en masse to get vaccinated. And people are responding and responding well.
The IPC trainings for health workers, I mean, does that also include addressing those who are hesitant to receiving the COVID-19 vaccine?
So with IPC training, we started IPC training for health workers before the index case in the state, April 10, 2020. And we've continued IPC training. And it's something, every public hospital has an IPC focal person. The state has an IPC focal person, and this has been cascaded down to every public facility. And then the private facilities has also been engaged in the IPC training. So because this basically will help us decrease the spread of this disease in the health community. And with respect to acceptability of the vaccine, we've tried to communicate to people. I know the initial scare against Oxford AstraZeneca vaccine. And we try to communicate to people that correlation is not causation. We try to communicate WHO's message that this medication is, this vaccine is safe, and we've tried to communicate that to our people. And we are noticing increased acceptability among our people. The vaccine is safe, and we also went ahead to create an online form that people can go to this online form after post-vaccination and report any side effects that they notice or any adverse effects. And it's real time. So this is actually nested on the state website. So it helps them to actually know that we're not just giving the vaccine, but we're also following up on them. And we have seen a lot of leadership in the state. The state leadership have come ahead to offer to take the vaccine. And we've seen a lot of leaders. Like today, we have our royal fathers, the traditional leaders in their numbers. They came out to get vaccinated. So the leadership we are seeing in the state is truly amazing. And then among our healthcare workers, they're coming out in mass to get vaccinated too.
Just before we let you go, just before we let you go, Dr. Okpala, and this is with regards to the phases for rollout. Does that also include representatives for the National Sports Festival in Edo State?
Definitely, we'll be vaccinating those. We have about 150 of them going for the sports festival, and their vaccination starts tomorrow.
We appreciate your time. Thank you so much, Dr. Vincent Okpala, the Commissioner for Health, Anambra State. Thank you for joining us on the program.
Thank you so much. Thank you.
We have more stories on the COVID-19 updates when we return. Please stay with us. Over to Ekiti State, the frontline health workers and others are getting vaccinated. Now, our correspondent Babajide Agbeyo reports that close to 300 people have been vaccinated in the first phase, and officials say no side effects have been recorded.
The first phase of COVID-19 vaccination is in progress here, and frontline health workers have been taking their first jab of the AstraZeneca vaccine. State government supervisory officials have been going round to monitor the exercise and ensure those slated for this phase are properly mobilized to do so. Public enlightenment is also being increased, especially to ensure people are not confused by news they hear around.
We have sensitized people across the local government and then, of course, at the state level to kind of dispel the misinformation that surrounds the vaccine that we all know about. And we've been saying that the vaccine is safe and the vaccine is effective. Vaccination have started in local government and, of course, at the primary healthcare centers and at the general hospitals. And of course, we've made adequate preparations for the safety of the vaccine. The first day of the flag off, where 70 people took. Then the other day, where about 210 people took. Now that it's gone to all the local governments, from my assessment, I've gone around like few centers this morning. It's really been encouraging. People are taking the vaccine.
For the state government, the protocols will still be adhered to, and enlightenment will not be watered down in any way. Babajide Agbeyo for COVID-19 update.
Let's find out what's happening around the world. Joining us, Dr. Joseph Essien, Emergency Medicine, NHS England, joins us via Zoom. Thank you for joining us on the program.
Thank you. Thank you for having me around.
I'd like to begin with what the Prime Minister said. I mean, what did he mean when he said the third wave of COVID in Europe is likely to wash up on UK shores?
I know the Prime Minister is trying to get us to be prepared, more like an emergency preparedness or a consciousness of the fact that we still have the coronavirus infection still with us, in spite of the fact that we have good vaccination programs going on. If we look at the numbers, we see that for example, in Germany, we have about 8,000 new cases and an average of about 13,000 over a period of 7 days. And we find the same thing happening as well in France, where we're having as much as 13,000 new cases. Even though we see that in the UK, we still have a daily average of about 5,000. The reminder that we need to be careful, we need to prepare, we need to do the right things, we need to get everyone vaccinated. And I think that's what the Prime Minister's message really is.
Mr. Johnson is also continuing to speak to European leaders this week to try to resolve the row over vaccine exports. I mean, we know that EU leaders will be holding a meeting on Thursday to discuss that. But how does this affect the relationship between the UK and the EU?
I strongly believe that the coronavirus pandemic is an international issue. So because of that, I don't think there would be any problem with the relationship. It requires a lot of negotiation, a lot of stakeholder building. And I believe that we need global collaboration at this point in order to ensure that the global supply chain is maintained. And we see lots of countries who require this vaccination. And I think they would always be able to come to some sort of agreement to be able to find a way to bring down the transmission rate of this virus.
Now, today, I mean, a year ago today, this was, I think, when the government first ordered the stay-at-home to contain the spread of COVID-19. And now, I think there's a gradual opening up. But we've also heard a number of people like the Welsh First Minister who said the timetable for ending restrictions in England looks at the very optimistic end of these spectrum. Tell us what the atmosphere is with, lockdown restrictions easing.
I think everyone in England is really happy with the government's roadmap, and we're trusting the government's guidance on what needs to be done, especially when we know that it is evidence-based. The WHO has recommended that people should have vaccinations, and about 27 million people in the UK have had their first dose, with 2 million people having their second dose. So that's really reassuring to see that there's a plan to let people have some level of normalcy after a very long time.
All right, Joseph Essien, emergency medicine doctor, thank you for joining us on the program. Stay safe.
Thank you.
Now, US officials say results on the Oxford AstraZeneca vaccine published Monday included outdated information and presented an incomplete view of the jab's effectiveness. AstraZeneca has debunked this, saying it was an initial analysis based on data up to an agreed cutoff date, February 17, and it would share further analysis with the officials. Here's more now, global COVID-19 update.
The highly unusual rebuke from the federal health officials in the United States comes a day after interim data from the drug maker showed better than expected results from the U.S. trial, which had been seen as a scientific counter to concerns that have dogged the shot since late last year. The vaccine, developed with partner Oxford University, was 79% effective in preventing symptomatic illness in the large trial that also took place in Chile and Peru, according to the data. It was also 100% effective against severe or critical forms of the disease and hospitalization, and posed no increased risk of blood clots. President of the French Hospital Federation, Frédéric Vallottou, says the country's hospital system could face an unprecedented violent shock in about 3 weeks if the country fails to curb its vertiginous rise in the COVID-19 cases. Last week, the government imposed a month-long lockdown on Paris and parts of the north after faltering vaccine rollout and spread of highly contagious coronavirus variants forced President Emmanuel Macron to shift course. Norwegian police have begun questioning Prime Minister Erna Solberg over a birthday party she held last month, which could lead to a fine of 10,000 crowns for breaking COVID-19 social distancing rules. The two-term Prime Minister has apologized for celebrating her 60th birthday with 13 family members at a mountain resort, despite the government ban on events attended by more than 10 people. Germany is extending its lockdown until April 18 and calling on citizens to stay at home for 5 days over the Easter holidays to try to break a third wave of the COVID-19 pandemic. During talks that ran deep into the night, Chancellor Angela Merkel pushed leaders of the country's 16 states to take a tougher stance to fight the pandemic, reversing plans for a gradual reopening of the economy agreed earlier this month after a sharp rise in the infection rate. Finally, South Korea's President Moon Jae-in today received the AstraZeneca vaccine as he prepares to visit the United Kingdom for a G7 summit in June. The 68-year-old attended a community clinic near his office in downtown Seoul with his wife and 9 other senior officials who will accompany him on the trip, including the National Security Advisor, Soo Hoon.
Continue to take responsibility. You can visit our website for more updates, a better understanding of the pandemic. You can also find several other stories there, news on politics, business and sports. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.